In British Columbia, politicians love to talk about universal health care, but what they don't talk about is universal suffering. Because in the Interior Health Region alone, 1,586 patients died last year while waiting for medical imaging or elective surgery. Not while being treated, not in recovery, they died waiting for the help that never came. These numbers, however, weren't released voluntarily. They were pried loose through Freedom of Information requests filed by secondstreet.org, a think tank doing the work the media and health bureaucrats won't. Let's look at what the government doesn't want you to see. In 2024-2025, 1,364 patients died while waiting for diagnostic imaging, the scans and tests that doctors use to identify strokes, tumors, aneurysms, and cardiac abnormalities. Here's the breakdown. 584 patients were waiting for CT scans, critical for identifying cancers, internal bleeding, and signs of stroke. 302 were waiting for ultrasounds or vascular imaging, tests used for abdominal pain, heart failure, blood clots, and liver disease. 158 needed an echocardiogram, a test used to diagnose heart valve failure or cardiomyopathy. 151 were waiting for MRIs, which can detect spinal cord injuries, brain tumors, and multiple sclerosis. Other deaths occurred while waiting for interventional radiology, 57 of those, often used for procedures like draining infected fluid or inserting stents. X-rays, 36 of those, basic but still important. Nuclear medicine, 35 of those, used to scan for cancer, thyroid disease, or bone damage. Mammography, 29, of course, we know that's breast cancer detection. And bone density tests, 28 of those, often used to assess osteoporosis risk. Nearly 40% of those who died had already waited longer than the priority wait time set by the province for their procedure. Almost half were labeled as priority level 5 or unknown, which in plain English means they were deprioritized or simply just fell through the cracks. Another 222 patients died while waiting for surgery. These weren't obscure procedures. These were common, often life-changing interventions. The top procedures canceled due to death were cataract surgery. There were 86 people who died. 17 people died while waiting for knee replacements. Stent insertions or removals. There were 13 people who died waiting for that. Pacemaker insertions, gallbladder removals, hernia repairs, all represented among the other 59 procedures impacted. Those specifics under 10 cases were suppressed in the data for privacy reasons. Again, 38% of these patients had waited longer than the clinical benchmark for their procedure. Benchmarks that are already very generous by most standards. Interior Health claims it can't say if these patients died because they waited too long, because they don't track the cause of death. This is the bureaucratic equivalent of just sticking your fingers in your ears and ignoring questions. And meanwhile, Canadians die waiting for care they were promised was universal and world-class. The healthcare system in British Columbia and across the country is not just overburdened, it's collapsing. People are dying for lack of a CT scan, going blind waiting for eye surgery, spending their final weeks in pain instead of recovery. This isn't just a matter of money, though. Interior Health gets plenty of that. What it lacks is accountability, innovation, and the courage to admit that rationed care by waitlist is killing people. This is a system that's abandoned its patients and abandoned innovation while adding more patients at record numbers through immigration. And the worst part of all of this, it's entirely predictable. For Rebel News, I'm Sheila Gunn Reid. One of the most atrocious parts of Canada's healthcare system is that they will offer you euthanasia quicker than you will get to see a specialist. We think people deserve help, not state-sanctioned homicide. If you agree, sign our petition at helpnothomicide.com.